I'm Sarah Ann Counsell. I'm a manipulative physiotherapist, a clinician and an educator. Manual therapy is a way of treating patients' pain and loss of function with the clinician using their hands and their intelligence. Mulligan Concept is pain-free manual therapy, meaning that the patient presents with pain and we're trying to immediately get rid of the pain completely and restore range of motion. Brian Mulligan is the creator and inventor of Mulligan Concept, NAGs, SNAGs, PRP and MWMs. Hands-on physiotherapy is essential. We are the prime leaders in acute and chronic care for patients with neuromusculoskeletal conditions, and we must use our hands and our heads and our intelligence and knowledge. My clinical practice has been influenced by many people. Actually, I started originally in head injuries and neurology, so you could go back to Bobarth, Peto, but when I went into neuromusculoskeletal conditions, obviously Maitland, Mackenzie, Syriacs, trained and did all those courses. Then I met Brian Edwards and I trained with him, and then I ended up teaching with him. Then I went to Australia and one of the guest speakers was Yanda, but another was actually Brian Mulligan. So I ended up working with Mulligan Concept, bringing Brian into the country and obviously teaching with him in America and in this country. And I've been in charge of the UK region of Mulligan Concept. But I also have Professor Toomey, Shirley Sharman, Robert Elvey, all these people are in the clinic with me every day. Obviously the wonderful Jenny McConnell. These are all the pioneers that have been around me all the time, and obviously I've created my own work now for the difficult patients that I work with. The advice I would have with a new physiotherapist that enters this profession is to encourage them to consolidate their learning and their education and to seek out wonderful clinicians that can teach them to master how to clinical reason and how to use their hands to a high level of expertise. I see a very bright future for manual and manipulative physiotherapy. We need lovely young clinicians coming in, learning more in terms of neurophysiology and physiology of pain, but also being able to interpret that in front of their patients and improve their manual and manipulative physiotherapy skills to encourage the patient to live a higher quality of life pain-free.